Listen, if you've got diabetes and you're dealing with that awful shooting pain down your leg, I'm here to tell you that is not a coincidence. And here's the part that's going to absolutely blow your mind. You could be in total agony, but your MRI might look completely normal. Today, we're going to pull back the curtain and show you what's really going on, what your doctors might be missing.
All right, let's get right into it. This is the big mystery that stumps millions of people. You're in excruciating pain. You go through the whole process. You get the gold standard test, an MRI of your lower back, and the report comes back normal. Maybe it says something like, minor age-related bulging, but nothing that even comes close to explaining the agony you're in. It's maddening, right? So what on earth is really going on?
And this is where the plot just thickens like crazy. Get this. Research shows that up to half of all people walking around with absolutely zero back pain have significant disc bulges showing up on their MRIs. Think about that for a second. That means finding a bulge on your scan could be a total coincidence. It could be a complete red herring that sends you and your doctor down the wrong rabbit hole, while the real reason for your pain is just hiding in plain sight. So, this brings us to what we're calling the pain paradox. Let's break it down.
And I want to be crystal clear about this. Your pain is 100% real. It is not in your head. There is a real scientific reason for what you are feeling. The problem is we need to stop looking only at the spine structure and start looking at its metabolic environment. That's the key. Okay, Section 2, diabetes and your spine. So how does diabetes actually launch a direct attack on your spine? This is the first piece of the puzzle, and it's something science has only really started to put together recently.
Well, it all starts with something called intervertebral disc degeneration, or IVDD for short. The easiest way to picture this is to think of the discs between your vertebrae as little jelly donuts, right? They're your spine's shock absorbers. IVDD is basically what happens when those little donuts start to dry out, get brittle, crack, and lose that cushion. And when that happens, they can bulge out and press on your nerves, causing that classic sciatica pain.
For decades, doctors saw a link. They knew people with diabetes seemed to have more back problems, but they mostly thought it was just a correlation. Maybe it was related to weight or lifestyle factors. But then, a groundbreaking study in 2023 just blew that all out of the water. Using this really powerful type of genetic analysis, it proved there's a direct causal link. It's not just a coincidence. Diabetes itself actively destroys your spinal discs.
And it all comes down to this number. The study found that just having type 2 diabetes directly increases your risk of disc degeneration by 8%. But here's the part that is so important. That number is after they accounted for body weight. This isn't about your BMI. This is the disease itself, the metabolic state of diabetes, physically damaging your spine.
So how in the world does it do that? Well, when you have high blood sugar, it leads to the formation of these nasty little things called advanced glycation end products. We call them AGs. And the absolute simplest way to think about AGs is like rust. Seriously, that excess sugar basically causes the delicate collagen structures inside your spinal discs to rust. They get brittle. They get weak. This whole process chokes off the nutrient supply, it kills off healthy cells, and it just sets the disc up to fail, to bulge, and ultimately to press on a nerve.
Okay, so that explains how diabetes can cause what we think of as traditional sciatica. But what about our original mystery? What's going on when the spine looks totally fine on an MRI, but you're still in agony? Well, this is the major plot twist.
Yeah, let's circle right back to the heart of this paradox. Your scan is clean. The discs, they aren't the obvious bad guy here. So this is the point where we have to stop looking at the hardware of the spine, the bones and discs, and start investigating the wiring, the nerves themselves.
And that, my friends, leads us to the hidden culprit, diabetic neuropathy. Now, this is crucial. We're not talking about a disc pinching a nerve anymore. This is about the metabolic chaos of diabetes, the high blood sugar, the inflammation, directly attacking and damaging the nerve fibers themselves. And here's the real kicker. This direct nerve damage can produce symptoms that feel identical to sciatica from a slipped disc.
So this nerve pain can show up in a couple of pretty distinct ways. The one you hear about most is a symmetrical pain, right? It starts in both feet and kind of slowly climbs its way up your legs. But there's another, less common but much more severe form called diabetic amyotrophy. This one can cause this intense one-sided pain and even muscle wasting, a lot of times in the thigh.
I mean, if you've ever had that bizarre one-sided thigh pain that nobody could figure out, this might just be the reason why.
Look at this case study. It is the perfect illustration of why a normal lower back MRI can be so incredibly misleading. So you have a patient, right? Severe leg pain. The scan of their lower back, the lumbar spine on the left, shows pretty much nothing. But the real problem, which in this case turned out to be a tumor, was way up higher in their thoracic spine, that image on the right. Now, this proves the principle perfectly. Just like a tumor can be the hidden cause, diabetic nerve damage can cause leg pain that has absolutely nothing to do with a bulging disc in your lower back. The point is, the source of the pain isn't always where you think to look. All right, so now it's time to bring these two major clues together for the big reveal. We've got two different types of leg pain, but they can both stem from one single underlying cause: diabetes. And for a lot of you watching, this is going to be the aha moment. Okay, if you remember one thing, let it be this analogy. It makes everything click. Sciatica from a disc, that's a plumbing problem. Think of it like a physical blockage pressing on a pipe. Simple. But sciatica-like pain from neuropathy, that's an electrical problem. The wiring itself is frayed and short-circuiting. See the difference? Both problems can shut the whole system down, but they need completely different fixes.
This chart just lays it all out, side by side. Let's break it down. A disc issue? Okay, that's physical pressure. The MRI usually shows it, and the pain follows a really specific path, typically down just one leg. But neuropathy, the cause is metabolic. The MRI can be so frustratingly normal. The pain can be in both legs, or it can be asymmetrical. And the character of the pain is different. It's often more of a diffuse, burning, or tingling feeling. As I'm saying this, does any of that sound familiar to you?
So what do you do with all this? I mean, this isn't just a cool science lesson. This is about empowering you. It's about giving you the tools to take back control and have a totally different kind of conversation with your doctor.
Okay, here's the big takeaway. If you've got diabetes and you're dealing with leg pain, but you have a clear MRI, your pain is not a mystery. It's not unexplained. It's metabolic. And just shifting that one word in the diagnosis from unexplained to metabolic opens up a whole new world of treatment and management. It lets you focus on the actual root cause.
What this means is that you can walk into your next doctor's appointment armed with specific, powerful questions. You can look your doctor in the eye and ask directly, could my leg pain actually be diabetic neuropathy, not just a disc issue? Hey doc, does my pain pattern, the burning, the fact that it's in both legs, does that fit neuropathy more than a structural problem? And the big one, given that my MRI is clear, what's our next step to investigate metabolic or nerve-related causes?
Now, of course, we have to say this, and it's really important. We're not your doctors. This is all for your information, to help you have a better, more productive conversation. You should always consult with your personal healthcare team to get a proper diagnosis and to create a treatment plan that's right for you.
So we'll leave you with this final thought. For years, maybe even decades, you might have been told that your pain was just a part of getting older, or that it was something you just had to learn to live with. But what if understanding this deep, powerful connection between your metabolic health and your nerves, what if that's the key? The missing piece you've been searching for all this time to finally solve your health puzzle?